Hey, everybody. Wow, that was perfect. Like the technology, all of that was perfect. We had a perfect transition. So we are thanking the Lord for that this morning. Good morning, everybody. This is Coach Monica here. I am so excited for today's show. We have been talking about this for several weeks now. And we've been getting our audience excited for this. And by the way, we are recording this. So if you missed this, we will have a replay here that will be available as the day goes by and as I do the editing. So, Courtney, we have been prepping our audience for you because my world has watched my life change after I found you. And I'm going to try not to get emotional because there's no time for that this morning. But you are doing God's work, my friend, and you are changing so many lives. And I just had to share you with my audience. Um, and so I'm going to let you do most of the talking today. I've got some questions for you that our audience and our my clients, the people who watch my platform have been asking. And so we're going to do that. And I want to let you know off the bat, I know there's all of this HIPAA stuff, and I am a patient of yours. But I want you to know that there's nothing off the table. So as much as you need to, you can just throw all of that stuff out. I am very, very open with my clients, and I'm very real with them because my goal as a weight loss coach, and Coach Darcy, by the way, Coach Darcy is on here with us today. She is taking care of all of the comments. And so if you have a question, she's going to let me know. She's going to flag me down so that I don't have to do that. And she's going to be talking to you through the chat. So welcome, Coach Darcy. But my clients know that I'm very authentic. I lost 120 pounds in 2017, and I've kept it off for the past 6 years. And I have hit mountaintops and I have hit valleys. And there are so many women who are struggling with the same thing. There's so many women who have been ignored by their traditional medicine doctors, by their OBGYN. They have been ignored for so long. And so when something like finding you and finding this whole beautiful medicine that you have found finds us, it's like, wow, I need you to tell more people about what you do. So I want you to know my chart is open for the world to see. So if you need to use me as an example, please feel free to do so. I want you to start by introducing yourself and telling our audience why you do what you do.
Sure. I'm excited. So I'm Courtney. I'm 41. I'm a nurse practitioner. I've been a nurse for 14 years, and the majority of the time spent in hospital-based medicine before I was an NP. I did a lot of critical care, a lot of with kids and adults as well. But was always, working at to be the best of the best with, in high risk situations and saving lives over and over and over. And all the while, I had a quiet autoimmune disease that I didn't know about. I knew all about it, but I didn't, there was no diagnosis for 18 years. So from the time that I was 17, 18 years old, I had something may have been going on genetic, but in a short span of time, I had been in a car accident. My parents were divorced, and I had a sexual trauma in a short amount of time. And that very quickly just stressed my body out and I have something called Addison's disease. And for quite a long time before my adrenals had completely quit on me, it was just this roller coaster for years and years of severe chronic fatigue and exhaustion and arthritis at the age of 26, and you have IBS, you have depression and anxiety. It looks like your emotions are just showing on your physical body. It must be emotional pain. Just one thing after another. Fibromyalgia. I was told I had fibromyalgia. They tried to rule out everything, from a rheumatoid standpoint, and made sure I didn't have cancer. And anyway, so for quite some time, I would have periods where, I could hardly crawl to the bathroom for a few days because I was so weakened and in severe pain every day. Didn't sleep through a night for 18 years. I was up every 60 to 90 minutes because the pain would wake me out of my sleep. And just a lot of different things were going on, but where the when my body finally just said, like, I can't do this anymore, I got pregnant with my son, and my adrenals could not support me and my pregnancy at the same time. And unfortunately, because there were other issues going on with my lungs, nobody figured this out until that was the beginning of my pregnancy, before I knew I was even expecting. Um, and then I went through my whole pregnancy, had multiple hospitalizations. They didn't figure it out. I had lung surgery. Um, it was only by the grace of God that my son and I are here today, because there were many um, risky moments. And so, anyway, it was 2 years later before I was diagnosed. I was down to 86 pounds. I was skin and bones. I looked like I was 60.
I just saw that picture of you. I would not have believed it on your website. I would not have believed that.
Yeah,
With
it was
wow.
scary. And the whole, I was just living on adrenaline all the time because I didn't have any calming cortisol or anything to keep up my blood pressure. So my body's coping mechanisms were just on 10 all the time. So, I had done all of my exposure in medicine was completely, Western medicine, allopathic medicine, and saving lives all the time. But when I went to graduate school to be a nurse practitioner, and I learned the family medicine route, I loved a lot of things about it, and I was going to go into family medicine. And the pandemic really kind of helped to change my trajectory. I was going to be somebody that was, not solving root cause issues, but let's just put a band-aid on it. Let's put
Wow.
3 band-aids on it. Eventually you're going to, need a hip replacement, but here's some steroids in the meantime.
Mm.
So, that kind of thing. The pandemic kind of switched that around. I was going to sign a contract to be in family medicine here in Warsaw. And, all the office visits went away, and they couldn't
Wow.
support medical offices. So I got I did some extra education in joint injection, and got picked up on LinkedIn by a clinic in Elkhart, and I provided services for them for a couple of years, and that's where my mind started to open to other options of integrative medicine, functional medicine, learning about hormone therapy, all that kind of stuff. So the last 3 years, I have been specializing in hormones, in regenerative joint therapies, learning more about IV nutrients and things like that, ozone therapy, and really learning to get to the root cause of things. So my tagline, is kind of like, I want to help you get your mojo back, right? But when I
Wow.
look at hormones, I don't just look at getting, helping you feel better and your mood better and your energy and your sex life. I really think about it from a global perspective of,
Yeah.
you know, deficiency of testosterone is going to cause problems with glucose metabolism. It's going to cause increased insulin resistance. It's going to cause type 2 diabetes and high blood pressure and high cholesterol and dementia. So I want to help people feel their best and enjoy and get a great quality of life. But I also really think about it from a global perspective of preventing chronic disease.
Wow. So there is something great that came out of those horrible years
Big
that we
time.
lived and that we all survived.
Yes.
The big pandemic.
Yeah.
You found your calling, and I'm grateful for that for sure. So let's get into some hormone therapy questions because those are the burning questions, and I want to talk about, and I'm just now learning this. I am diving into this myself on the nutrition side. Can you talk about how hormone therapy, how our hormones impact our weight? Because that's kind of our niche. I specialize in obesity and food addiction, as well as reversing things like type 2 diabetes and things like that. But the whole hormone world is something that I'm just now realizing, wow, we have missed this. We have missed this big time. It's enough that I've changed my entire nutrition program for this. So, on your side of the world, can you talk about how the hormones impact our weight and obesity?
Well, really, so much of it's very hard for your body to lose weight when you're inflamed. And chronic inflammation is the cause of so many issues. But specifically talking about weight, it's hard to lose weight when everything is inflamed.
Mm-hmm.
So, the number one job for testosterone is glucose metabolism. When you don't have appropriate glucose metabolism, then your insulin level goes up. Your body can't bring that nutrients into the cells. It
Mm-hmm.
stays out in other tissues and in the bloodstream where it's not supposed to be. It irritates everything in its path, and your systems aren't processing correctly. When things are inflamed, you have these little worker bees in your cells called mitochondria. Every cell has thousands of mitochondria that produce energy for them. And so when you are inflamed, your mitochondria aren't going to work well. There's a lot of things that have to happen on a cellular level for your processes to work efficiently. So the main thing really is, people don't think women need testosterone, but we desperately need it. It's our number one, it's our most abundant hormone in our body. We just have such a different ratio of estrogens to give us our female characteristics and such, but we really need it. So the blood sugar metabolism is a very key component to being able to reduce inflammation.
Mm-hmm.
And that's something that, you do, you're able to accomplish that, lowering insulin levels and things like that, with the ketogenic diet.
Mm-hmm.
Um, I mean, that is a huge component. And I have to say, even though we're not talking about gut health today, gut health is
Mm-hmm.
crucial to reducing inflammation,
Mm-hmm.
to producing hormones, to helping our bodies, detoxify and help you lose weight.
Oh yeah, yeah, that is so true. And I'm feeling what the difference is of being low. That was my problem. I was low testosterone. I was high estrogen,
Mhm.
and basically I was a hot mess.
Yeah.
And and so I am realizing personally the difference of feeling the health changes that I've gone through, and it is a process. It is one long process, and what I want to get through to my audience is we need you to be patient, both on the nutrition side as well as on Courtney's side. Is patience is everything in this, because
Mhm.
there are things that have to, like she said, change from a cellular level. And we're in such a society of quick fixes. That is Coach Darcy and I's number one issue is we live in an age of convenience, and it should be fixed with a pill. And that's what traditional medicine has taught us. We have a problem, we fix it with a pill, and we
Yeah.
expect it to be changed versus the cellular level. And when we are patient, my clients have heard me talk about the story of the woodcutter, and they know what that means. It's sometimes patience is absolutely critical. So let's talk specifics. So let's dive into what you do. Let's talk about pellets, and let's talk about hormone therapy. Okay, so you provide the subdermal pellets. Okay, a lot of people are like, well, what about the shot? What about the testosterone shot? What about the patches? Can you kind of divide those up and teach us a little bit about what you do on the subdermal pellet level versus the other options that are out there?
Yeah, absolutely. Um, so not everyone, obviously it's individualized medicine, but pretty much almost all of my patients that I treat with testosterone and estradiol are done in a subdermal pellet. When you have a troche, which is like a lozenge, or a cream, or a patch, or even injectables, and you take your dose in the morning, your level will go up. And then by the end of the day, your level goes down. And every day we're going up and down, we're vacillating, and you will get an improvement of the baseline of hormone deficiency. You will get an improvement. It will take the edge off of things. But really, my goal is to bring you more to optimized levels of your testosterone and estrogens, not always with the estrogens, but when you're feeling your best. So when your systems were functioning correctly, your mood was best, your energy was best, your libido was best, your muscle recovery, all that kind of stuff. That's where I am trying to aim for. And that is not able to be accomplished with topical treatments. The injectable testosterones, you can get levels up there, but unfortunately with injectable testosterone it's not bioidentical, and there are more complications with it. You're more likely to convert it into a way that would put you more prone to acne and hair loss. It can, particularly in doses with men, it really can cause some issues with too much blood or liver issues and that kind of thing. When you have creams, now, progesterone cream is a great thing, especially for younger women. But with a lot of, broad strokes here, talking about topical treatments, your creams, a testosterone gel can rub off on the sheets. It can transfer to your children and your grandkids. It is not going to stay just on your arm. It can transfer to your pets and that kind of thing. So, and again, it's not going to get you to an optimized level. So with a subdermal pellet, I just numb the upper outer part of your tush. And you've been through this, Monica.
Not scary at all.
No. And
No.
let me just kind of chase a squirrel here. After working in the ICU for 11 years and in the ER for 2 years, I've seen a lot of painful procedures, and it's very important for me to make sure that my patients are comfortable.
Yeah.
So everything, if I really try to stay on time, but if I'm ever running a few minutes late, it's usually because someone deserved a thorough understanding explanation, or I refuse to go too quickly with my numbing and just jab things in people. So, it's really not a painful procedure. But with the subdermal pellet, it goes under the tissue and into the fattier tissue, and it's released based on your cardiac output. So if you have a particularly busy day, you're going to work out, you're getting your cardio in, you're lifting your weights, you're running errands, you're doing a lot of things, it will release more hormone to meet your metabolic needs. If you have a Saturday on the couch, it will release less. So it's the closest way that we can mimic your body's natural release of hormone from the ovaries or from the testes for a man. So that really, it is the best way we can mimic nature and get your levels up to a higher level, to a more optimized level. That's why I love the subdermal pellet, and they last. So for women, they last anywhere from 3 to 4 months. Once we've got you on a routine and everything, they'll last you 3 to 4 months, and for men, they'll last 4 to 5 months usually.
I saw a video this week. I have a lot of interest in this because I think that probably if I had to profile my clientele, I would guess probably 80% of them need this because we are so deficient in these hormones. And so I've got a lot of people looking at this, and I was sent a video, and I think I know the answer because I think I know my body enough now after working with you to understand the issue. From a very scared client saying, "Okay, here's a video that says these are not the way to go." And in this video, the person who was promoting more injectables said, if you put a pellet in, she's heard stories of that patient's growing a lot of hair and voice deepening, and she had a testosterone number of 500. And the problem with the pellet is
You
you
can't
can't get it out. What is your response to that? I think I know, and I'm gonna cheer if I told her the right thing. But what is your response to somebody who said, "Don't go the pellet way because you're going to grow hair and you're going to go into the 500s"?
Don't put a man's dose of a pellet in a woman's butt.
Yay! Don't put a man's dose. That's an irresponsible practitioner, correct?
Exactly, exactly. Or someone who had a very, very like overwhelming response. I have never seen a woman in that
Uh-huh.
level ever. So there are lots of different, I have a whole cabinet of pellets. There are lots of different doses, and it's
Mhm.
all customized based on your weight, your age, your activity level. And then as we work through, over the few months, okay, how
Mhm.
are your
My
symptoms? Are you
labs,
burning
right.
off?
Right.
We've been doing this, right?
Mhm.
How's your energy? How's your motivation?
Mhm.
Going through those things, it has to be customized to meet the
Mhm.
person's need, the individual's
Right.
need. But she's right. Once you put a pellet in, it 99.9% of the time that sucker ain't coming out.
Right.
So, unless they get an extrusion or they don't
Yeah.
follow my instructions and they go do leg day for my men,
Yes. Yes.
then you may lose a pellet or two, and that's not on me. That's on you. But
Right.
yeah, don't treat that's like it's like never mind. Don't treat a woman with a man's dose. Let's
That
just
is
leave
so
it
true.
there
And you also make me have labs done before my booster. So you
every
know
time.
exactly what my testosterone is, if it's working, or like we did with the continuation of the Dutch test, am I metabolizing it correctly because I'm estrogen dominant?
Right,
And that seems to take over the T, right?
right.
So you are hands-on with your patients, and you know us better than we know ourselves, and that was exactly my response to her, was that is a very irresponsible practitioner if she did that. So um
Yeah,
a nice
absolutely. We get labs before every repellet, and it's not like a full panel. We don't have to go ham on everything. It's what are we treating? If we're only treating testosterone, then that's what we'll evaluate. If we're treating testosterone and estradiol, so it really is customized to only what my patient needs.
Yeah.
But we look at labs. We also look at your clinical symptoms. So every time I see you and you have your blood drawn, you fill out a sheet that goes through all the details of your
Right.
symptoms and how does this number coincide with these symptoms in Monica, right?
Hmm.
So,
Yeah.
with other people, I had someone recently that really doesn't feel good until her testosterone level's at 300. And
Hmm.
then I have other people who are just like, I'm living my best life at 95. So it
Hmm.
really has to be customized to what they need.
Yeah.
You cannot use broad strokes with this, and that's probably part of why people don't want to do hormone therapy,
Hmm.
because it is complicated, it's
Hmm.
messy, it takes patience, and then as the provider, you get people like, oh, this is something's wrong.
Yeah.
It's
Yeah.
hard.
It is.
So
Same with
it
being
really,
a weight loss coach. A lot of
yes,
people, we get in the pit with our clients. We go down I had a really bad day.
mhm,
My marriage is falling apart. We do the stuff that weight loss shots, pills, potions don't do. They don't
mhm,
deal with those issues, and those are the real issues. And
right,
and that's why a lot of people don't want to take the time to do weight loss coaching, and they just want the easy way.
right.
Talk to me a little bit about there's a stigma when you get into the hormone therapy. There's a stigma with cancer. Can you take us down that path, and then the last half of our show we're going to talk about the thyroid. We'll do a little switcheroo on you, um, but talk about the stigma and what is this connection between what they're telling us about cancer and hormone therapy.
Absolutely. It's a great question. And it's something that prevents a lot of people from improving their life. About 20 years ago, there was a medical study called the Women's Health Initiative, and it evaluated two different types of estrogens. One, which is a horrible estrogen and that nobody uses, and the other one that's still used to this day called Premarin. It's made out of horse mare urine, so it looked to evaluate patients after were their breast cancer risks increased or decreased, were their heart disease risks increased or decreased on these two hormones. But unfortunately, this study had quite a few flaws. The majority of women that were studied were more than 10 years postmenopausal and then were started on these hormones. Um, and additionally, it looked at, without getting too nerdy, there's looking at statistics from an absolute risk versus a relative risk. So basically, they saw an increase in some breast cancer risk. I'm sorry, but when you're dealing with an older population that have, like, as a a side note, men, like almost 80% of men that are 70 years old have prostate cancer.
Mm-hmm.
It hasn't grown, right? So if you have a woman that is postmenopausal and she may have quietly growing breast cancer that we don't know about, and you give her a hormone that's going to increase her body's, hormones don't cause cancer, but they help things to grow faster.
Mm-hmm.
So when you hit puberty, you got your breast tissue, you got your hips. That's how hormones work. So anyway, when they're evaluating this, it was really about 8 in 10,000 women was the increase in the number of breast cancer rates. But when you look at it appropriately, when you looked at it inappropriately, they said, oh my gosh, we have to stop the study right now. So the study was halted. They printed an article in JAMA, which is the Journal of American Medical Association. It's the #3 publication for all physicians in the United States. They educated the entire medical community that hormone replacement therapy is dangerous and causes cancer, and they cut it out. And what happened? Our breast cancer rates did not go down. In
Mm.
fact, heart disease and stroke became the #1 killer of women in the US.
Wow.
So, when you're treating hormones, you do have to be cautious. I'm hardcore with my patients. Like if we're ever going to treat any estradiol, I have to have annual mammograms. I have to see it. You can't
Mm-hmm.
just show up and say, "Oh yeah, I'm going to get it." Nope, that doesn't work for me. I have to make sure that you are cancer free before giving you a hormone that could help it grow faster. I'm not going to give
Mm-hmm.
somebody cancer, but could I help it grow faster if I was irresponsible? Yeah, I could. Additionally, when we have people that start to look like they're not metabolizing or aromatizing their estrogens correctly, there are different pathways as you've learned on your Dutch.
Mm-hmm.
There's different ways that your body breaks down estrogens. And there are healthy ways to do it and unhealthy ways to do it.
Mm-hmm.
So if you are someone who goes down the unhealthy pathway, you are more prone to cancers. And it's, ovarian cancer, breast cancer, uterine cancer, cervical cancer. So it's important to know what those are. So as I get into treatment with somebody, if it looks like something's off with these hormones, this is not the standard path,
Mm-hmm.
we do a Dutch. And we have to look and see how is your body uniquely processing those
Yeah.
hormones.
That's the test from hell, just so you know.
I know, right? It's such a pain in the butt. It's such a pain in the butt to do, but it gives us so much
So
information.
glad I did it. So glad.
And, and then I also keep patients on a supplement called DIM. I
Mm-hmm.
use orthomolecular products. All my supplements are very high quality. They don't have allergens and things like that. But DIM is a nutrient from cruciferous vegetables, like capsules, like, 10 heads of broccoli or whatever. But basically, what that supplement does is it encourages your body to break your testosterone down in the healthy, it keeps more testosterone as testosterone. So less of it breaks away into estrogens. And then what does go into estrogens, it supports the healthy breakdown or the healthy detoxification pathway.
Mm-hmm.
So when you're managing those things, you're helping the body to function better and healthier. And so, we're preventing, you can not get hormone replacement therapy and have horrible estrogen detoxification and still be at risk for cancers.
Right.
So,
Right.
it really matters how your body processes those
Yeah,
things.
that makes sense. Can you talk about the difference between a synthetic and a bioidentical
Yeah.
hormone and what you
So
what you use?
I only use bioidentical. So what that means basically is my pellets are like a compressed powder. I actually have one. One second. I should have had it ready. Here you go. They are a compressed medication powder. They're sourced, a lot of this is sourced from yams, actually. So it's a plant made. Here's our little pellet.
Oh, wow.
Yep. And
I've never
so,
seen that. I'm always facing the wrong direction when you put
yeah.
that in.
Yeah. So as that pressed powder starts to dissolve based on your activity level, it will the molecules will go into your bloodstream. And a bioidentical is something that your body recognizes, hey, my ovaries made that. It's the same exact molecule as what your body looks like. So your body doesn't have to convert it, process it, do a bunch of stuff to it. With a non-bioidentical, specifically like injectable testosterone and things like that, your body really does have to go through a few processes to convert it to make it usable.
Wow. Okay. That's awesome. I don't think I'd ever asked you that question before. I want to turn the ship around a little bit. All of these things go together. When I see Courtney, we look at the whole body, not just the pellet, not just the low. Could you give, like, in 2 seconds? Could you give the top symptoms for low testosterone?
Yeah, fatigue, irritability. My kids are driving me crazy. My husband breathes way too loud for me to tolerate. I can't handle my stress. I have low libido, or I'm not enjoying my intimate life. Um, Poor motivation. I'm working out, but I can't maintain muscle. I'm retaining belly fat, hot flashes, night sweats, dryness of the vagina, anxiety, depression, huge.
Yeah. Literally checked all of those off. And I have to just give my personal experience. The first round, um, I felt something. I just didn't know what it was that was different. I felt, and I'm supposed to fill this check mark off, for Courtney every time I go in. I'm like, I don't know what it is. I just feel different. The second round, I felt um, I felt it all basically. I was like, wow, you just gave me my life back. And the third one even multiplied that. And so it's a progression. You don't necessarily, some people may, but I didn't feel it the first time. Um, Second one, it built up, and then the third one was like, okay, I feel like I'm not hating my husband. Okay, so I'm excited about the fourth one.
Yeah.
um, let's turn the ship a little bit and let's talk about probably my number one issue or my hurt with my clients, and that's the thyroid. The thyroid is, I think, so abused, and people have been going to traditional medicine, getting labs that they're being told, oh, you're fine, your TSH is fine, everything's fine, you don't feel good, okay, here's a pill, maybe this will fix you. So take us into the thyroid world. We have about a half hour left, so that's kind of where our gauge is here, because I do want to make sure people know how to get a hold of you. And I do have a question about men as well. Sometimes they're left out of the picture, and so I want to talk about how you treat men as well.
Yeah.
But take us down the thyroid world. What are you seeing in your practice? What are you doing that's different from traditional medicine when it comes to your thyroid?
So, when I was originally taught to evaluate the thyroid in family medicine, the standard of care is usually a TSH with reflex to T4. So that means TSH is a standard, is looking at how hard is my brain trying to tell my thyroid to get to work. Okay. How hard is it not picking up what it needs to do? And if your TSH is greater than 4, meaning your brain is working too hard, then we'll look at a T4 level. We'll see what your body is actually producing. And the problem with that is you can have tons of dysfunction of the thyroid and have a normal looking TSH or a normal looking T4. So, what I do when I initially evaluate someone's thyroid, I look at the TSH. T4 is how much am I producing? T3 is the active form. Your body actually has to convert T4 to T3 to be able to use it in the body. So, am I able to convert what I produce into the usable form? And then, is my body attacking the thyroid? So, do I have autoimmunity? Is inflammation, you may not have classic autoimmune disease, but you have so much inflammation that your autoimmune titers are starting to increase to attack your thyroid. And then, also, am I producing something called reverse T3? This happens, and especially with patients or clients of yours, it's more likely to happen if you don't trust your coaches and take it slow.
Oh
So
my gosh. Yeah.
if you lose weight too quickly, you will shut the thyroid down. You will make your body go into a hibernation type of state. So it will convert your T3 hormone in the liver to something called reverse T3, and it does
Mm.
the reverse. It shuts down your normal thyroid processes. So if you lose weight too quickly, you have been ill, or you've recently had your birth. Hi.
Sorry. He does it every time. I had him sitting over there so he'd be good, and I knew it was coming.
Um, and
Oh, Winston.
so your body can basically shut things down and say, okay, I've gone through too much. This is stressful. Uh, Hold the phone, and we're just going to hunker down for winter until we get through this storm. And it shuts down your metabolism. So then you get exhausted. You can't lose weight. Your brain fog. You have menstrual issues. Fatigue, hair loss, dry skin, flaking nails, blah, 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 low libido, so many things, depression. So much of that is related to the thyroid. My mentor, um, Dr. Angela DeRosa, she calls the thyroid the axis of evil.
Wow, so
because
true.
because it does so much, and when it is off, it's off.
Uh-huh.
It's bad. So I look at the thyroid pretty thoroughly when I see you at first,
Mhm.
and treating the thyroid. So if you have somebody that has an elevated reverse T3, and I give you thyroid hormone, like, yeah, you don't have enough T4 or you don't have enough T3, let's just give you a pill. If I do that, your body is just going to make more reverse T3.
Mhm.
It doesn't get to the root cause. So, really, we kind of need to look at what's causing this. Is it a mineral deficiency? Your body needs, zinc and selenium and acetylcysteine and other things to help convert T4 into T3. So, are we replacing the minerals that are necessary? That's a very big component. We don't usually get what we need from our diet.
Mhm.
And ps Brazil nuts, if you can get yourself to eat them and get used to them, Brazil nuts are a phenomenal source of selenium,
Yeah.
natural. You're not taking something. So mineral deficiency is quite a thing. But then looking at what else is causing this inflammation. So you know you've been with me from very early on in the beginning stages of Mojo Med, and my dreams for this are to have a nutritionist and health coaching and that kind of thing. Right now it's me, and I have Tasha on Mondays. So right now I
Oh,
can't do all the things that I really want to do
yeah.
with people. But you know are you, if you're eating gluten,
Mm.
gluten looks like the T3 molecule. It can
Mhm.
block your thyroid. Gluten causes inflammation in the body. So,
Mhm.
just there are lots of things that you can do to reduce the inflammation in the body. I do a lot of ozone therapy. So,
Mhm.
working with ozone to calm down an overactive immune system.
Mhm.
And then, also something called low dose naltrexone. I have
Mhm.
patients that are on low dose naltrexone, which you think naltrexone like Narcan,
Mhm.
drug addicts, but really, that's what naltrexone originally came out with. Was it was 50 to 100 milligrams is the dose for substance abuse disorder to block the opiate receptor for 24 hours. But with low dose naltrexone, it's like half a milligram to 4.5 milligrams, and it only blocks that opiate receptor for like 4 hours.
Mhm.
And when it does that, your body doesn't have something to calm things down, right? So it says,
Mhm.
oh, I need to increase my anti-inflammatories. I need to increase all these little different substances that help to calm down the body.
Mhm.
So that can help to reduce inflammation, help to lower your reverse T3 as well. There are different
Wow.
ways to look and get to the root cause of what's causing,
Yeah.
this, instead of immediately putting
Mhm.
someone on a pill.
What about iodine? Does iodine factor into that?
Huge.
Okay.
It's so necessary. It's so necessary. I was trained that, oh no, you get iodine in your salt. You have iodized
Mhm.
salt. We have enough in our diet. It's not true.
Mm-mm.
We need it for our immune system. We need it for our thyroid.
Mhm.
My daily immune supporting vitamins are A, D, C, and iodine.
Okay.
And I love that. But it's necessary to convert your thyroid hormone for sure.
Yeah. Wow. That is so. I want to scream from the back of the room, and if there's a way that I'm able to edit this video, I would take if you lose weight too fast. Um, you'll crash your thyroid. And on my side of the game, you will lose weight if you try to lose. Starvation diets always bring weight loss, right? Calories in, calories out. There's a big myth on that, a big controversy in the weight lost world about calories in, calories out. But the fact of the matter is, taking shortcuts on this side, after I've been in maintenance, I lost 120 pounds. Maintenance is hard. Maintenance is probably I'm in a journey right now with maintaining my weight loss. And if I would have known on the front side, now thankfully I chose the nutrition side instead of a pill or a potion, or there's so many things. And even as keto coaches, we call it keto crap because there are things that they put in products like wheat that they say is keto, and it's throwing our clients off because of the gluten, because of all of those factors. And so nutrition really does matter. And Courtney, I have a big vision for you. I have a massive vision for Mojo Med, and I know that you are feeling the pinch right now because just my little bit of clientele, they're like, Monica, we can't get in until November. What do you want us to do? And so my vision for you is massive. God has big things for you, and because He does, that's going to impact so many women and so many men. So let's talk about, you have couples come to you. So
Mhm.
this stuff is reality, guys. We live in a fast paced world where, again, instant fixes are all over the place, and we have very, very frustrated couples and men. We talk a lot about women because we work with a lot of women. And I personally work with a lot of perimenopause, menopause women who feel like their bodies are alien, like right now. They're like, what is happening to my body? And so that's my passion, is I work with a lot of women, but we have a lot of men clients too. So what happens if you have, we'll take this down two routes. If you have a couple come to you, because I giggled at our pre-note uh, planning here about what you do with couples, but then what do you do when it comes to treatment of men? Do you have a
Sure.
different treatment protocol for men, and why do they come to you?
Listen, men are like a crock pot, okay? They just have a couple settings. Women are like your convection oven, microwave, all the different, you have 30 settings on this convection oven. How do I get this right? Men, it's like they're much easier to take care of than women are. And when
Same
you,
in the weight loss world too, by the way.
I know it's not
It's
fair.
not fair.
But let me just also preface with perimenopause starts in our mid 30s, ladies. It starts in our mid 30s when our ovaries are producing less testosterone and a little less estrogen, but our estrogen is stored in the fat. Testosterone is not. So when your testosterone level is going down, you wonder why by the time you hit 40, you're thinking about divorce and you're thinking about your kids are driving you crazy. And no, this started usually in our mid 30s and for some women earlier. But anyway, I take care of couples. And, I firmly believe that if we treated hormones, the divorce rate in this world would be a whole lot lower because we could tolerate each other better. We could handle stress together easier. We would have better coordination, being in sync in the bedroom. So when I treat men and women, it's kind of fun to be able to do the consultation together. And Men also get pellets. They get a lot more testosterone than the women do. And I also have to manage their estrogens as well. So whether you get environmental estrogens coming in, their bodies don't produce it necessarily from their testes, but fat cells will produce estrogen, and you get estrogens coming in from your environment. So making sure that we kind of get those things managed for men is a lot easier than taking care of a woman. But when you treat a couple, I either start them simultaneously or I'll start the woman first, because the last thing that you want to do is get a man feeling better, stronger, more motivated, and ready to go for his wife. And she's like, just get
What
away.
the
Just
heck?
get away.
Yes.
That is, I will have a herd of angry women coming
Mm,
after me if I do that. So I usually will start to treat the woman first. And a lot of times women will seek out care before men will anyway. So we
mhm,
start to treat women and they're like, hey, do you take care of guys too? Because my husband can't get off the couch, or
mhm,
whatever it is. So, but you always, ladies first. Let's
mhm.
be a gentleman. Ladies first. Let's get her started so that you are feeling better, more energetic, more receptive to intimacy when your husband's ready to go.
I love that. I
But
love that.
really, it's also important to know that for men, menopause or
Mhm,
early andropause, it starts early for them too, where their motivation goes
mhm,
down. Maybe they need a nap during the day that they can't live without. Um, their mood, they're just irritable, cranky, maybe they're not sleeping too great. But most men don't think they have a hormone deficiency until we have problems with erectile dysfunction. That's the last thing to take a hit.
wow.
So usually that's the last thing to improve.
Mhm,
Your body, your hormones have to get better and better and better. And sometimes it'll take a few rounds where there's not really that much improvement
mhm,
with erectile dysfunction. And then something changes and they've stayed at a nice therapeutic,
mhm.
stable level for a while. And then their libido gets better. And then their
Wow.
function gets better. But yeah.
Wow. That is powerful. We do have a question here from somebody who's watching. Let me put it up on the board here. Any recommendations on collagen?
Hi, Vanessa. Yeah, sure. Let me grab mine. So there are different collagen forms. A really good quality bone broth is always a great source of collagen. I like the orthomolecular collagen a lot. This is a tasteless powder. You can put it in your coffee in the morning. It goes best in a hot liquid, so if you do coffee or tea, but you can totally throw it in with a shake or whatever. But this one, doesn't just have regular collagen, it has vitamin C in it. It has a connective tissue kind of blend to help. So it helps with your joints, helps with your hair, your skin, all that stuff. But it also has magnesium to help it get absorbed better. So the vitamin C and the magnesium really kind of improve how this is going to get absorbed in the body. So this is kind of my favorite. I really like this guy. I also have little packets you can just take to
Okay.
go packs with you as well.
Okay.
But if you have a really good quality bone broth, that's also that's also a really good thing. But not
Awesome.
everybody is willing to drink bone broth.
Yeah, that's
I'm
tough
not.
sometimes,
I've
and it's
tried it. I'm
expensive.
not willing to drink
Yeah,
bone broth.
no, it's not. And then there's a lot of fake bone broth out
Mhm.
there that really, are nothing more than chicken broth or something.
Right.
So,
This is
yeah.
like this has 30 scoops in it, so it's about $2 a day.
Oh, that's perfect. I love that. And the people can get that from you when they come see you.
Sure.
Or okay, all right.
Sure.
So
Yep.
let's say that we have talked to two different parts of my audience. So, um, you are here locally. You're very very busy. You're going to grow. It's going to be amazing. You're going to get a new building, by the way, because you've got to grow out of that building, which I think you already have.
I'm busting at the
um,
seams.
you're busting at the seams. So let's say that you have really spoken to the heart and soul of a client of mine. What things do they need to prepare for you? What is the next steps? And kind of give us a line by line. Okay, I know I have a need, I have a problem. What does my path to healing look like? And then also speak to somebody who maybe, we have clients in Israel right now. And I know you can't go that far to speak, but what does somebody do in another state? What do they look for to find a Courtney? How do they go to a wellness doctor? Do they go to a whole, what is it specifically that they need to use and put in their verbiage to look for somebody like you? And then how can you help my clients here locally? What do they need to do?
So, I would say, as far as like reaching out in other areas, I believe you can go. So the company that I do my pellets with, I prefer. It's called Belmar Pharmaceuticals. It's the highest quality that I've been able to find for a few different nerdy reasons. But you can find a Belmar provider through them if they've signed up. I believe you can through Belmar Pharmacy. I'd have to take a peek and maybe send you a link to that. There also is a large company called BioT or
Mm-hmm.
TE that also does subdermal pellets. I prefer the Belmar pellet therapy, but if you're looking for a pellet provider and you don't have, like, there are lots of really well trained providers for BioTE.
Mm-hmm.
You just kind of see if you can find someone that isn't just certified in pellets, but are they also doing integrative or functional medicine?
Integrated. That's the one. That's the word I was looking for. So
Yeah,
that's something that they need to use because,
yeah,
to be honest with you, Courtney, I did do the BioT a couple of years ago with a place in South Bend, and they put the pellet in, but they just dropped. I mean, there was no follow up, and there was no labs. There was just like, okay, here's your pellet. Well, most people they don't feel the pellet results the first month, and so and I didn't. I
oh,
didn't
on
feel
the
anything.
contrary, you're special.
I'm
You're
special.
special. On the contrary, most people walk in at 5 weeks and they're like, oh, dang, girl, I feel
Really?
good.
Okay. So I was a little
You're
slower than
special.
most people. Okay. All right. But because I didn't feel it, I am I was like, well, it doesn't work for me and so I quit. You know, where I needed you to do my labs again, I needed you to to walk
Yeah,
me through it. So, yeah.
yes. Um, the let's see. In the beginning, when you so I place pellets and they last about 3 to 4 months.
Mhm.
There are plenty of providers who will put a pellet in and say, okay, see you in 3 to 4 months, bye.
Mhm.
And they completely forget about the fact that we're coming out of the ditch. Like, we are coming from hormone deficiency, and you're
Mhm.
gonna burn through that first pellet faster than any other.
Mhm.
So, as your body is, I'll tell people it'll be two weeks before you even notice anything sometimes.
Mhm.
A lot of times when I'm correcting a vitamin deficiency, they notice that quicker than they would, within days or a week
Mhm.
before they would notice the pellet. So you really kind of have to take into consideration that you've got a lot of receptors that are really hungry for testosterone,
Mhm.
and you're gonna burn through that first pellet
Mhm.
faster. So when I see patients in the beginning, I do see you more often. Normally it's every 3 to 4 months, but in the beginning, I draw labs at 4 weeks and we look at the symptom survey. What has improved? What's yet to improve? Where
Yeah.
are we at? And how does that correlate with your number? Right.
Mhm.
And then what I do is I say, we draw your labs at 4 weeks, then you see me at 5 weeks. And between week 4 and 5, it's really time to take a really good self inventory. Was my motivation better and it's down? Was my mood better and now I'm cranky? Did I have a libido and now I just don't feel like it? Noticing, having a good self inventory of what has improved and then what is kind of fizzling off is very helpful for me to know how you did with that first dose
Mhm.
and how quickly you'll burn through the next one. So I see people for a 5 week booster pellet visit. It is a fraction of your original dose and it's completely individualized. But the reason I do the booster and I provide it at cost, I know none of this is covered by insurance. I know, it's frustrating. Um, so I do the booster visit at cost. It's like $85 flat fee, and you pay for whatever pellets that we use. Um, but I do that because I want you to do it my way, and I want you to get good results. So when you do the booster, while that first dose of pellets will just kind of slowly be dying off, right? You come in here with a booster and you get this little guy to start dissolving. And basically, what you get in the middle is just this therapeutic plateau where you feel better longer.
Mhm.
So that when you see me in 3 or 4 months, you're not back in the ditch. You're not feeling
Yeah.
horrible. You know it's time for another pellet, but it's not like you feel like when you first came to me.
Oh,
So
so true.
my process is a little different than a lot of people's processes, and I do it that way because I want people to get better
Yeah.
results.
Can you
Um,
talk to us about the cost and what, and not exact cost, but what would people expect? I know I fought you on taking the Dutch test because I'm like, I don't want to invest in that. I felt like I was buying insurance,
You
honestly.
know,
And yet, and my Dutch test came back, and I don't understand at all. It was like perfect. I'm like, come on, Courtney, tell me what is wrong with me. There's something wrong with me. We waited down to the last part of that test. There's a little red arrow, which was my problem. Had I not taken that Dutch test, I wouldn't have found my problem because of
no.
my I didn't know how I was metabolizing these things. So sometimes I honestly felt like I was buying insurance, like, oh, I don't want to do this. So talk to us about the cost and the investment. And you're right, insurance. And by the way, I am hot to trot to go to DC to figure out how we get wellness doctors approved in our insurance and given us a medical choice on how we do our medical visits. But
Yeah.
that's my other life in my lobbying world. But talk to us for the last part of our session here. We've got about 4 minutes left. What is the cost? What do people expect when they hire you?
So, the initial labs usually are around $150 unless we're digging deeper to look for autoimmune issues. So initial labs are right around $150. My consultation fee is $90. And then when you're doing a pellet visit, the cost of the office visit and all that is just wrapped up in a flat fee. So for a female pelleting, it's $350, and you can expect that about every 3 to 4 months. For a male pelleting, it's $750 because I use way more medication on a man than I do on a woman. My cost is, even though women are harder to manage, men are way more expensive to treat.
Mhm.
So, but a man's pellet will last 4 to 6 months. It depends on their activity level, really. And then again, that booster right at the 5 weeks is like $85 flat fee with whatever pellets we use. So it's usually right around $100. Um, so that is, you can always submit this. I take HSA, so it will work for HSA, even though I don't work with insurance companies. Just about the only thing an insurance company will cover are your labs and office visit fee. That's about it.
Mhm.
They do not think that hormone therapy is worthwhile, but they'll pay for an open heart surgery. So that's on
Absolutely. Oh,
them.
wow.
But when you're preparing for an appointment with me, it's best, if you're over 40, I need a mammogram. So making sure that you're in contact with your primary care doctor. I would need the reports for your most recent PAP within the last 5 years. And then, if you've had labs in the last 3 months, I'm happy to use them. You don't have to only use my labs. I'm not going to be that way. If I can save you money and you can capitalize on your insurance, do
Mhm.
it. A lot of providers are not comfortable with ordering some of my hormone labs because they aren't going to manage it. But I do have some providers that, they're in primary care and they say, hey, I don't know what to do with this, but if this can help you get better, and I have some primary care doctors that
Mhm.
are totally like they collaborate to do labs with my patients. So
Wow.
it kind of depends. But if you can have those sent over, it makes your first visit go a lot easier. And then
Amazing.
if you have labs on my chart, it's not helpful for me. So I'll send you a records request form and we'll request them from the hospital system itself, because that way we'll get actually a list of labs instead of
Mhm.
one per page. And
Love it. I love
yeah.
it. How do people find you, Courtney? I know you said you're booked into November, right? Is that what I
I'm
heard?
end of October right
End of
now. I'm in the
October.
third, fourth week of October right now
Okay.
for initial consultations, because the timing of those is specific. We do fasting labs, so I reserve my 9 a.m. hour for my new patients. If you have any people doing intermittent fasting and they want to let me know that, I can get them in a little sooner, earlier
Mm-hmm.
in
Okay.
October. And so that's fine. And then all my men pelletings always are first thing in the morning for a few different reasons.
Okay.
So, but once you're on a routine, you're in the schedule, you've got your spot. So,
Awesome.
yeah.
Awesome. And
Um,
do you have a website, or where do you want our people to go to
I
find you?
do. I don't love my website, but it's a work in progress. So it's mojomed.net.
Okay.
Mojomed.net. And then definitely follow me on social media. So Facebook, I'm on Mojomed. Instagram is actually mojo.med, but you'll
Mm-hmm.
see my little icon there. And I'm kind of a one woman show right now. So I try to post things and be informative, and that way you can kind of follow along. But bear with me as I, try to get back to you. I really am a one-woman show right now. And that will be different. That will change. But for now, that's kind of where we're at.
That's
And
amazing.
I often will reply to you after I've got my son in bed for the night, to be honest. So
Yeah. You've changed my life, Courtney, and I'm so grateful for you. I'm so grateful for what you're doing with my clients. We believe in hope dealing, and that's what Coach Darcy and I do together every day. We walk with people through their journey of weight loss, and I love what you do, and I believe in you, and I believe we're going to watch you expand, and God's just going to bless you for everything. I'm going to download this. I'm going to download this show today. I'll send you a copy of it. But any questions that you have, reach out to Courtney. Reach out to us. We're happy to help you if you are struggling with your weight loss journey. If you're struggling with some of the issues that Courtney talked about today, please reach out to us and know that there's hope, and know that you will absolutely feel the change once you say, okay, I'm ready to invest in myself. So thank you, Courtney, for everything. I know you have patients to go see, and we're going to sign off of here today, but thank you for joining us for this hour today.
it's been a pleasure. Thanks, Monica. I'm glad you got your mojo back.
I did. I absolutely did. Thanks so much, guys.
Bye.
Bye-bye.